It's like care is not again created equal. We've had this discussion before in this province around, for example, when we were struggling with our ICU capacity. An ICU bed in the surgical ICU in Regina, for example, is not the same as an ICU bed in Swift Current. Like, they are two very different things in terms of what you can do with a patient in a place like Regina with all the access to specialists and other medical and surgical expertise versus a place like Swift Current where, you know, the care would be relatively basic. So the same principle applies to a medical bed, you know, as well. There are certain things sometimes where a person is too medically complex. They require, you know, all of the various services and support measures and expertise and specialists that the big cities have. You can try and push those people through as fast as possible and get them to a point where they're more stable and can be transferred, but that won't be enough probably to, again, manage the crush of patients that we have. And rural Saskatchewan and smaller peripheral centers are feeling the staffing crunch much, much more significantly than places like Regina and Saskatoon. If you have a small hospital with 10 or 15 beds and they've got, say, 10 or 15 nurses, you know, on their roster, and 5 of them are out, you know, because they need to isolate or because they, you know, have COVID, for example, you know, that's going to make it far more difficult to maintain operations at that site compared to a large place like Regina or Saskatoon, where you've got a larger pool of people to draw from, you know, to try to kind of maintain things and keep things going. So it's going to be challenging over the next several weeks, no question.